Welcome back. I'm Barry Craig. Can this shoe really help prevent an amputation if you have diabetes? My guest today says the answer is yes. He is John Ryan of Paducah Prosthetics, apparently the only board-certified podorthist in this neck of the Kentucky woods. Welcome to the program.
Thank you, Barry. Thanks for having me.
This looks like an ordinary shoe, but this thing can prevent you from losing toes or feet or legs if you have diabetes. How is that so?
Absolutely. This is what's called an extra depth shoe, and patients that have people that have diabetes that are on the you're entitled through Medicare to receive shoes and custom inserts to prevent skin breakdown and ulcerations, that kind of thing. So these shoes are specifically designed to accommodate those inserts and still have plenty of room, for the person's foot. And it's not just the extra depth shoe per se, but it's also the fitting of the shoe. You can have what we consider healthy footwear, and if it's not properly fitting, you can still run into problems.
So with the person who has diabetes, the problem is the loss of sensation in the feet. They can't feel a blister, which becomes infected, that becomes gangrenous, and that's the problem.
Absolutely. With the peripheral neuropathy, folks, you could have a pebble in their shoe and not even realize it, and it's not until they would visually inspect their feet that they would see that something was occurring, like you said, as a blister or a pressure area.
You told me a story before about a patient that you saw, a man who came into your office with what looked like a toothpick sticking out of the bottom of his foot.
Yeah, this person had already had a wound in a different area of his foot. He had been going to the wound clinic for months, which is not unusual for this population, and he had been cleared by the wound clinic to to go ahead and measure him. And in this case, was for custom shoes where I do a plaster mold. So upon visually inspecting his feet, I did notice, like under the toes there, I saw a little, what appeared to be a part of a toothpick sticking out. When I looked at it further, in fact, that toothpick was halfway in this gentleman's foot. I pulled it out, and it was infected, and that just kind of goes to demonstrate how this gentleman didn't feel any of this. If it was on my foot or your foot, Barry, we would have known about that. And pain can be a good thing in this case because it's a warning. It's telling you something's going on. Mm-hmm. So of course I had to I sent him directly back over to the wound clinic, and fortunately they were able to get him healed up fairly quickly. And a month later I saw him, and we were able to to get his custom shoes. I think for this gentleman it was a wake-up call. Obviously he had been walking around barefoot in his home, and was what I surmised, and that's how that happened.
Mm-hmm. There are certain do's and don'ts for people who have diabetes, and we also talked before, a lot of people who have the disease don't realize the danger of the neuropathy and realize how this can literally save an amputation. So if you have the disease, do you have certain do's and don'ts you talk with your patients about?
Well, sure. And my end of it isn't really the dietary thing. I do mention that. Obviously, weight loss can be a factor. Oftentimes, folks that are diabetic, simply by losing weight, can become where they're not diabetic. Obviously, I tell them you cannot walk around the house barefoot. That's a big one. You need to have some type of protective footwear on at all times. Due to the fact that even you keep a very clean house, there can be things on the floor, a little piece of glass or something. So that's one of the big ones, is don't walk around barefoot. Another thing is you need to visually inspect your feet at least once a day. I mean, really look at them. Oftentimes you can have a spouse can do this for you. Some folks, if they're overweight, they have a difficult time actually seeing the bottom of their feet. So we recommend that these folks get a mirror and actually visually inspect their feet.
Mm-hmm. Mm-hmm. Well, when people come in to see you, are some people, or a number of people with the disease, unaware of this neuropathy with the shoes and all that? They don't realize that can happen to them?
I think so. A lot of times, if they've been told by their physician that they do have neuropathy, some people know it because they have kind of strange sensations. They'll complain of burning and these kind of vague type of symptoms. So they don't have good sensation as far as when they're feeling. per se. However, the sensations they do have aren't really good ones. So I think people do underestimate how serious this can be, and oftentimes folks have to run into some problems, unfortunately, before they really do take it seriously.
Another rather chilling statistic you were telling me about was that once the amputation process begins, it really does shorten your life at that point.
Yeah, and I'm trying to pull it off the top of my head, but I believe it's close to 70% mortality within 7 years of the amputation. Now, obviously, if this is a traumatic amputation, it's not what we're discussing today. Their outlook is probably better. And it also depends on, from that point on, how this person reacts to that as far as dietary and doing all the things that we ask them to do.
Kentucky, I looked this up, we ranked 7th in the nation in incidence of diagnosed cases of diabetes. We've gone up from 9th to 7th in the last few years, so this is really a problem. Is it because of our lifestyle?
I think, if you want to call it kind of the Southern lifestyle, as far as dietary, may very well have a lot to do with that. If you're sedentary, in other words, you're not very active. I think here we tend to eat greasy foods, things like that. That certainly will contribute to that. One of the things I wanted to mention too is as far as a person that's been diagnosed with diabetes, whether they use insulin or not. People I think that use insulin, they may tend to take it more seriously
I'm sure.
than those that don't. Excuse me. But the incidence of ulceration, which could lead to amputation, is exactly the same whether you're trying to control diabetes with oral medications, diet, or in fact you have to use insulin. I don't think a lot of people really realize that. So even if you're controlling your diabetes with your diet, if you have neuropathy and some of these other contributing factors, poor circulation, swelling in the legs, you're still at just as high of a risk as the next person that does have to use insulin.
Why does the disease cause the neuropathy?
Well, and that's a very complex thing. It's a whole cascade of events on a cellular level, and I could probably sit here, if I could pull it out of my head, off the top of my head, for hours, talking about how this occurs on a cellular level. But suffice it to say, it is a cascade of events, and over time there are changes that occur on a cellular level, which affect the nerves and the cells.
Right. And again, going back to what we had talked about earlier, oftentimes people have to wait until they've lost a toe to really get to take this seriously. Going back to diet, do you talk to patients about diet, that maybe you shouldn't eat so much fried stuff? And is it smoking also?
Yeah, I think that's another one. Obviously, in Kentucky here, we're in a big, tobacco state. So I don't know what I haven't seen any studies on what proportion of the population smokes. I suspect it's probably higher in Kentucky than some of the other states.
And smoking is a contributing factor too.
Absolutely, because it's with the nicotine being a vasoconstrictor, it impedes good circulation. So if you got somebody that's diabetic with neuropathy, has swelling in their legs anyway, it's difficult for good nutritional oxygenated arterial blood flow to get to the extremities. So I'll mention the smoking. I'll mention weight sometimes. I think what's funny is that some of the physicians, and I don't mean it humorous funny, kind of tap dance around this because you may be afraid of offending someone and that kind of thing. So I try not to come at it or look like I'm coming from a judgmental place. It's more about this is real. These are some of the factors. Recommend you try to do something about it. Get a dietary consultation. Those kind of things.
Something else we talked about was a lot of people who have this disease are elderly. They've been living their lives independently. They pretty much eat what they want, wear the clothes they want. And you get someone who has worn these, fashion shoes or reasonably fashionable shoes, and now they have to wear these unattractive shoes. Is that difficult getting people sometimes to forsake the fashion for what they need? It
sure, and sometimes I think that's probably the most difficult part of my job is trying to educate folks to the level that they understand and are willing to change things. Oftentimes, if I have folks coming in that are beginning to have problems with their feet, maybe callus formations, they've got bunion deformities. These are predisposing factors to, developing ulcers. Oftentimes I really have to do a lot of education to get these people to the place where they're willing to change something. You can't. I often say you can't do the same thing and expect a different result. Obviously, you're having problems now. We need to change some things. So.
Another thing too it's important is even socks, because even socks with seams can cause problems.
Yeah, that's true. And if you've got if you're wearing a heavy sock with a big seam in there, and sometimes that end of that sock can get bunched up. You put that in with ill-fitting footwear, normally the pointy-toed type shoes that really don't have enough room for their feet as it is. These can cause pressure areas, and when you put the pressure on the toes, again, they're not getting the blood flow, and these are the kind of things that can lead to these ulcerations.
And someone else another Pedorthist was saying that a shoe is the only article of clothing that we wear that could actually hurt you. A pair of pants too tight, a shirt too tight, so what? But if your shoes are ill-fitting or improper, they can do serious damage.
Absolutely. And again, if the people, many times if they're coming to see me, they're beginning to have problems, and that's the kind of thing we need to educate. Education is the best thing I can do for any of the patients I see, in my clinic, and in the community in general.
One bit of education you can do is explain what a Pedorthist is. I would imagine most people watching this program have no clue what a Pedorthist is or what a Pedorthist does. So,
that's true. A Pedorthist, we specialize in basically feet, foot and ankle. The vast majority of what we deal with is diabetes, but not necessarily. We also do things for plantar fasciitis, some other different type of pathologies.
That is a common foot ailment. Explain what that is.
Well, simply, plantar fasciitis is basically an inflammation of the connective structures of the foot that help keep the arch up. And oftentimes it's caused by folks that are kind of flat-footed or tend to pronate or their arch kind of collapses. So, thousands of times a day when they're taking a step, they're yanking on that connective structure, and it gets a chronic inflammation and will cause pain. So oftentimes if you can support the arch, stop these excessive motions in the foot and ankle and support that area, that will resolve.
Another thing too, go ahead.
Pedorthist also, we do modifications of shoes. That's just a typical extra depth shoe. Sometimes we have to do rocker bottom modifications that will offload certain areas.
You brought another shoe too.
Yeah, this is, I know those out there in the viewing audience are going to say that's an ugly shoe, but this is a gentleman that actually has lost all his toes, a transmetatarsal amputation where they cut off right at the ball of the foot.
Was that from diabetes?
It sure was. And he's on both sides, actually, lost all the toes. But he's got good blood flow now up to the end of where the amputation. That site looks very good. But people that have these transmetatarsal amputations, the foot really tends to widen over time to where you're really not going to accommodate them with an off-the-shelf kind of extra depth shoe. So in that case, we have to do a custom shoe. This is where I do an actual plaster mold of the foot and ankle. Send them off, and the shoes are actually made off of that mold. Then we have to do a toe filler. Obviously, that this person has no more toes, so we fill in the front of the shoe there to make it more cosmetically pleasing as we can. However, obviously, a custom shoe is always going to look like a custom shoe. Excuse me. When a person has lost all their toes, there's other things you need to do to give them a base to roll over and have a normal gait pattern. So oftentimes we'll do a rocker sole modification. Sometimes you have to put a steel shank in the shoe to inhibit the shoe from bending at all. And there's other methods that we can use to create some type of a base for this person to roll over so that they're not kind of clomping around. It'll give them a more, a more efficient gait pattern.
And of course, all this works together. I mean, you want to be as mobile as possible, and if you become immobile, it gets worse.
Yeah, absolutely. I mean, it's kind of a catch-22 for folks because they've got these medical problems, which means they can't get out and exercise or walk around the block and those kind of things. So if there's anything I can do to help them become more mobile, to get back to doing the things that they enjoy and want to do in life, then that's wonderful.
Mm-hmm. Now, your facility, of course, also does artificial limbs as well as braces. And of course, as a pedorthist, you might see a patient with diabetes who's lost one leg, and you're trying to make sure he or she doesn't lose the other leg too. So you work together with that.
We sure do, and sometimes I think that can be overlooked. If you've got a person that's already lost a limb, so they've got a sound limb hopefully on the other side, well, you really need to pay extra attention then to that sound limb to make sure that you keep it that way. As you know, I often joke with my patients that my job is to keep you away from my colleague Daniel Record, who's the prosthetist. Mm-hmm. So that's my job, is to keep you away from Daniel.
Mm-hmm. Mm-hmm. And you also mentioned too that sometimes patients come in and see these artificial limbs, and that's kind of a wake-up call.
Well, sure. If you come to my office, it's most likely you're going to either see another patient there that is an amputee, and if you walk around my facility a little bit, there are legs in various stages, being made, being mm-hmm. fabricated, mm-hmm. laying around. So yeah, you'll see people catch a glance out of the corner of their eye, and that'll kind of. I'm not there to rattle them or to right. or to scare them into anything, but I do. I'm pretty straightforward, and sometimes I'll tell I'm here to tell you what it is, not necessarily what you want to hear.
Mm-hmm. On Tuesdays, you travel to Clarksville, Tennessee, to take part in a pilot program under Medicare for people with diabetes. Talk about that program.
Yeah, that's actually, and it's not every Tuesday. We do have an office in Clarksville, Tennessee. I go there every Tuesday to see my regular patients, but it's once every month or every other month. I go down there and participate mm-hmm. in this program. It's a Medicare pilot program where people, CMS or Medicare identifies people that fit the criteria. They come in, excuse me, and it runs the full gamut of diabetic care. They're given a lengthy dietary education. I'm part of that team as far as fitting the shoes, doing my education part, informing folks of all these do's and don'ts, and how important wearing proper footwear is. They also see a nurse. They track their glucose monitoring. So it's a pretty intense program.
Team approach.
Exactly. Right. It is a team approach.
Mm-hmm. One thing you brought with you is this fancy thermometer, and again, this astounded me. Talk about this gizmo and how important that is.
All the members that are in this pilot program, and perhaps in the future this will be available to other Medicare beneficiaries. But studies have shown that on the foot, approximately three to 4 days before an ulcer is about to erupt, you may look at the foot and not visually really see any redness or anything, and if they have neuropathy, they certainly don't feel anything. But studies have shown that you will get a temperature difference in just that area of the foot about 3 or 4 days before an ulcer is going to erupt. So they just place this thermometer on different areas of the foot. They're also given a chart which kind of shows the 7 areas, and daily, preferably in the morning before they're doing a lot of walking, they would go ahead and take temperature readings of these different areas. Now, what you're looking for...
Hold that up a little bit. Mm-hmm. Yeah, we can see it. Oh.
What we're looking for with this is not necessarily that number. People's a normal foot temperature would be anywhere between 70-something degrees and almost 90 degrees. But what you're looking for is a disparity in one area of the foot. Mm-hmm. Actually, I had a patient yesterday that came in that had an ulcer on their heel. So I was seeing them. We're going to do some things to offload that ulcer. Mm-hmm. And I tried it on them, and there was a 6-degree difference where the ulcer was as opposed to the rest of the foot. So it really does work. And if you can identify an ulcer before it's going to erupt, we can there's various ways we can offload that area and prevent the person from getting an ulcer. a recent study in one of my journals said that it was able to cut by 2/3 the amount of ulcers people that use this on a daily basis. So really a good little tool to anyone. A company named Xylus invented this. You can buy them on the internet. And unfortunately right now insurance does not pay. Some of the private insurance may, but Medicare doesn't.
So what would that cost approximately?
I'm thinking about $170 on the low end, and that quote to me might have been more of a wholesale price, but this can be found on the internet. Anyone who's had a previous history of ulcerations or amputation, I would recommend consider getting one of these little devices.
It's a lot cheaper than the long-term cost.
Certainly is. An ulcer, I know this isn't out-of-pocket cost for a patient, but the typical ulcer costs around $10,000 to heal. And some of the legs cost $30,000, $40,000 for an above-the-knee computerized leg.
Explain, if you would, the Medicare benefit for people with diabetes.
Sure. People that have been diagnosed with diabetes, you have to meet one of 5 criteria. I don't know if I can spiel them all off, but it's like edema, which is swelling, poor circulation, previous history of ulceration or amputation, peripheral neuropathy. If you do meet one of these criteria, and a doctor has to sign something stating, in fact, this is the case, this beneficiary is entitled to 1 pair of extra depth shoes, the off-the-shelf shoes, or custom shoes if necessary, and normally 3 pairs of the diabetic inserts. These custom-made diabetic inserts, they're made out of such a soft material that they break down over time. So that's why they're given the 3 pairs. They normally kind of bottom out after 3 or 4 months, so then the person would swap those out. And that's every year, and it goes by the calendar year. It used to go by, let's say you got them in March, you used to have to wait till the following March. But now, if you've received your shoes in 08, anytime in 09, you can get a whole nother setup. And typically I like to see these folks every year. That's what I tell them. I just want to see you once a year for maintenance and not in my office with problems.
How well known is this benefit, would you say?
Well, I think it's pretty well known. Obviously, there's a lot of folks out there that are probably in need that aren't aware of this. So, by you allowing me here on the show, hopefully we can get that word out to folks that are in need.
It's interesting. In the past few years, you're finding more and more pharmacies in various places with diabetic footwear, which obviously is an indication that this disease is really growing in Kentucky. And in a way, it's kind of surprising because with all the information out there now about healthcare, especially not smoking, that this continues to be a problem. And it's obvious, as I said, looking at the statistics, we've gone from number 9 to number 7 in just the past few years.
Yeah, we're going in the wrong direction, and it's an epidemic. I mean, anybody, if you pay any attention to the media, whether print or news, something about diabetes about every other day. And there's we talk about it's somewhat of an impending crisis coming up with this aging population, the obesity and the diabetes, and Medicare beneficiaries. It's important that we make that Medicare dollar count by I think making sure that the folks that are fitted for their diabetic shoes, certainly if they're having problems, make sure that you go see somebody that really knows what they're doing.
Now, explain how you become a Pedorthist, a certified Pedorthist.
Right. Yeah, and right now it's not any kind of degree. They're wanting to raise it to an associate's degree. I don't know if that'll be in 09 or 010. Right now it's a very intense 3-week program. I went to Northwestern University out of Chicago for mine. It's a week of very intense didactic or kind of classroom, and then you've got 2 weeks more of a hands-on where you're actually doing modifications to shoes and kind of bringing what you learned in the classroom, into the real world, so to speak.
And then you take a test.
Yes.
You're certified by the American Board for Certification in Orthotics, Prosthetics, and Pedorthics.
Yes,
Pedorthics now.
Yeah.
Right. Now in Kentucky, I believe they're contemplating a law in the legislature to license Pedorthists. Some states do.
Yes.
And I think the argument for that is that this has more prestige to your. Well, doctors are licensed. and that too. Another thing too, and we've talked about this before, is there are out there a certain number of unscrupulous operators who come into town, go to a motel, and say, "Come to us, and we'll fit you with your diabetic footwear."
Right, right, and yeah, unfortunately, and quite frankly, I wonder how they even get away with it. I mean, when I see somebody comes to my office, I have to create a legal chart, which can be audited by Medicare at any time. Obviously, we have to the HIPAA, privacy concerns, all this kind of thing, and also I have to, I physically have to fit the patient with their shoes. So some of these unscrupulous, as you characterize them, characters out there are, just measuring folks, and I think half the time sending them their shoes in the mail, so there's kind of no follow up. That kind of thing. Also,
well, isn't that illegal to send them by mail under Medicare rules?
Yes, it is, from my understanding. So again, I kind of don't know how these people are getting away with it.
But they turn up. They'll typically take out an ad in the newspaper, and you get some elderly person on a fixed income who obviously is looking to not have to pay as much, come here for cheap shoes, and then they leave.
Right. There is no follow up whether to know whether those shoes fit properly, or aftercare. Do they have problems? Who do they call if they have issues? Let's say a spot is rubbing, or I don't think they have anybody to call. They come in from out of town, so they're certainly not going to fly into town to check on a pair of shoes for someone. So yeah, and I think they place these large ads saying free shoes, and all you got to do is have diabetes and free shoes. So Medicare, I know, frowns upon this. I just don't think that we've been very proactive with kind of looking into this further.
Enforcement.
And I think we need to. Like I said, I think it's becoming increasingly apparent that Medicare needs to get better bang for their buck.
Mm-hmm. Mm-hmm. And I think that's part of the impetus toward licensing is, again, this makes the profession more professional.
Yes, I mean, obviously, we need to have at least some minimum standards and a minimum, education for these people.
Thank you for coming out today. I enjoyed this thoroughly, but we're out of time, as always is the case. I'm Barry Craig. My guest today was John Ryan, board-certified Pedorthist here in Paducah. Please join us next time. Thanks. Thank you.